Hey everybody, Carmen here. I am your host of the Myo Minute, and I am on vacation, so you have a little bit of different scenery here. So I'm going to make this pretty short and sweet so that I can get back to vacationing. But I wanted to make sure that I showed up here live for you guys like I do every Wednesday. So my new blog came out this morning, and the topic of that was what intervention to prioritize. So I'm going to continue to drill down a little bit on that. Because I get a lot of people who ask, okay, what do I do? I know I have concerns, what should I do? And it's hard because you've got a lot of other people just giving you advice, and those people may or may not be somebody in that position to do so. So I'm going to talk more about that today. So that, before I jump into that discussion, let's just back up just a little bit about really what you should do. You guys hear me talk about this a lot, either a free 30-minute assessment or a comprehensive exam. Now that's my own program that I do. Some people start with a free 30-minute assessment because it gives them a chance to get their questions answered. They get to meet me, they get to see what the technology is like. If they can't stand me, if they can't stand my voice, you know, any of that crazy stuff that would make it not a good match, then I don't want them to work with me. I want them to find somebody else so that they have their person. But everybody who works with me has to have a comprehensive exam. And so I call that arming yourself with knowledge. And that's so that you can, you understand what it is that you have concerns with. It helps you understand why your symptoms are related. That's my whole job, is to connect the dots for you. So when you say, well, I had ear infections a lot as a child, I can help you understand why that is a concern. So that's what that comprehensive exam does. It also helps you understand your impairment. So I talk about this ad nauseum every time I talk to you guys, that I don't want to do therapy with just everybody. I want you to understand why you have concerns. I want you to set the goals to get better. And I want you to own it before you decide you're going to do therapy with me, or we're both going to just suck. We're going to hate meeting each other. You're not going to value the therapy. I'm not going to look forward to seeing you, and that just doesn't work for me. So comprehensive exam is going to give you a lot of information. So then next, finding that provider. This has to be the right person to do the job right the first time. And I really struggle with this as far as a provider, because many of you are in areas where you want to have a frenectomy and you just want to go to your local dentist or your childhood dentist, any of these people that may or may not be able to do the job correctly. And I talk about this a lot too. Every dentist, every one of these professionals who can do a frenectomy for you, that they've been trained. That doesn't mean that they've done very many. Some of them haven't done any in years. Some of them are man or woman enough to say, okay, this is not my comfort level. I'm going to refer somewhere else. And I love it when clients do, or when doctors do that, because it makes my job easier, because I don't have to fight them. If they know that it's their weak point, then please don't work on my clients. So finding that right provider is very important. I tell you guys all the time, be ready to travel, be open to traveling. Because if you don't, then you're not going to be happy with the results. And 9 times out of 10, I'm going to tell you that you need to have it done again. So we don't want to do that. And actually, next week in my Facebook Live, I'm going to talk about things to consider when choosing a provider. So that's going to be next week. And I'm really going to drill down on that so that you know. I don't want you just going to Joe Blow. If they don't understand myofunctional therapy, if they don't understand the reason that they need to do therapy beforehand, and if they don't bring it up, run out of the building like it's on fire. That's not your person. And so we'll talk more about that next week. But that leads me to jumping in a little bit deeper on what you should do first as far as a priority when you're doing your frenectomy. So there's a couple different modalities of body work that people will email me and say, hey, Carmen, like, what do I do first? First, I always tell you guys, myofunctional therapy and a frenectomy are cornerstone therapies. They go hand in hand. One should not happen without the other. And meaning, if I have somebody who has a tongue tie and they don't want to have myofunctional therapy, they're not working with me because I want to sleep at night, and I'm not taking their money for me to do something with them that is not going to be successful. The other way around is I definitely don't recommend doing a frenectomy without doing myofunctional therapy. So they go hand in hand. Whether it's with me or somebody else, I don't care. Find that person that works for you and do the therapy together. Do it, start it when you're supposed to, a month to 6 weeks before, and then you're going to continue it afterwards. So that's important. So people say, okay, so Carmen, what else do I do? You've probably heard the terms craniosacral therapy. A lot of people do massage. Some people do chiropractic care. So I wanted to just talk a little bit about those and when, in my humble opinion, when you should do those. So first, let's talk about craniosacral therapy, which is a gentle manipulation of the skull joints, parts of the pelvis, and the spine. I have never done craniosacral therapy. I should do it just to experience it. Many of my clients really swear by it. A lot of people like to do CST before their frenectomy, and so I completely support that, and I love that idea. If you cannot afford to add that at that time, then I don't feel like it's something you need to worry about then. I tell my clients, you do things as you can afford to add them in, aside from your frenectomy and myofunctional therapy. So if you don't have the money to do those things correctly, then save the money and do them right. Remember, as an adult, you are not in a hurry for those items. I mean, you don't want to wait 6 years. I totally get that. But if it's a matter of, if you skip the correct myofunctional therapy now so that you can have your frenectomy, you're going to regret it at some point in the future. So don't mess that up. But add the other things as you can afford. So craniosacral therapy is one of those things that a lot of people love to do when they're preparing for their frenectomy, and I totally support that if you can afford to do it. If you can't, then then you have to make that decision. Let's talk about chiropractic. So chiropractic works on hard tissue, obviously the bones, and alignment. So it's an important piece of the puzzle. Many of my tied clients, they're just throwing their money away at chiropractic care because they don't adjust well, they don't adjust for very long. It depends on why you're going for chiropractic care, but I have a lot of clients that stop chiropractic care until they have their frenectomy done, and then they really put some money in that area. Posture and chiropractic care is an important piece of the puzzle. What I don't want you to do is I don't want you to seek out a crack and collect kind of chiropractor. We all know that there's those chiropractic clinics that they're, on every corner somewhere, pay $25, get an adjustment. I encourage my clients to find a chiropractic advisor, a chiropractor who really works like in functional medicine, that really they understand the big picture. And it's not just, somebody who's going to adjust you and take your money. But a lot of people find that if they wait, it's going to be much better. Massages. Let's move on to massages. So that's muscles. So, you guys know we are a bag of bones, tendons, ligaments, so connective tissue, muscle, all of that stuff. The chiropractor works on the hard tissue and the structure. Muscles, a lot of people, especially my clients that have this, this yucky upper body tension, they get massages all the time, which is lovely. So I don't necessarily say I want you to hold off on massages, but I just want you to understand that you're going to feel better and get better benefits from that once you have some release. Another thing I want to talk about, and many of you guys have probably never heard about this, is something called Rossiter. So I, in addition to being a myofunctional therapy coach, or a myofunctional therapist, I am a Rossiter coach. And Rossiter is a 2-person connective tissue stretch. So it's very intense. I do it with my feet. And obviously I don't do it online. So I have a Rossiter studio for that. But it helps create that open space again when we have connective tissue that's just all bound up. So I say that our connective tissue, when we don't have the right space in our body, is like if you took a piece of aluminum foil and you just bound it up, that's what it's like. So when I do Rossiter, I'm helping somebody work through those intense stretches to create that space again. If you can find somebody who is a Rossiter coach in your area, that's going to be fantastic, because all of these pieces of bodywork that I'm talking about are something different, and they're all a piece of the puzzle. So some of my clients don't understand why, if they do myofunctional therapy, why they need to do chiropractic care. So if somebody has a tongue tie, their shoulders are rolled forward, their posture stinks, a lot of them have forward head posture, you know, that's a piece of the puzzle. Having a tongue tie done and doing myofunctional therapy is not your end-all be-all. So it's not going to solve everything. We're great, but we are not omnipotent and all-knowing, all-powerful. So you have to have a team for sure. So that wraps it up. Let me recap. Frenectomy and myofunctional therapy are your cornerstone therapy, so you're going to build on those. Then, as you can afford to do the other therapies, certainly do that. I would say craniosacral therapy would be my first choice, and then you can do massage, chiropractic. If you can find Rossiter in your area, that is going to be fantastic. So that's it. Let me just remind you that if you have questions about your myofunctional impairment, at the bottom of any one of my blogs, and that blog page is myofunctionaltherapy4u.com, and that is the number 4, the letter u.com/blog. You can go to the bottom of any one of my blogs and get my assessment. What is that assessment going to do for you? It's going to help you start putting one foot in front of the other as far as if you have concerns. If you're anything like me, you like to figure stuff out before you contact a person. So take that assessment. There's 25 questions. It's going to help you figure out if you have concerns. Then you can reach out to somebody. It doesn't have to be me. Find a myofunctional therapist who you have a good personality match with, and let that person take you down that path. Let that person be the one to help give you an exam, get things figured out. So that assessment tool is what most doctors that I work with here in the United States, that's what they use to screen. So it's a super great tool. So you can get that at the bottom of any one of my blogs. Next week, I told you I'm going to be talking about what to consider when choosing a provider, and this is a pretty important topic. So please, if you're questioning, if you think you're just going to go down to your childhood dentist that has been practicing for 900 years, then you might want to tune into this, okay? Super important stuff. And then last, since I am traveling, I don't have any of my fancy videography stuff, but if you find us on YouTube, we're small but mighty, we're growing. You can follow us on Facebook. I am here for you guys every single Wednesday. So next week, I'll be back home in Colorado, so hopefully spring will have sprung while I'm gone. Have a beautiful, fantastic day. Thank you guys so much for everything you do and bring to my business, and I'll see you next time. Bye for now.